Hi, my name is Jamie Register, and this presentation is on ambulatory care clinics. In this setting, the population served is varied across many different ages, religions, genders, and racial backgrounds alike. Most of the population pay through private insurance or cash for a means of payment, and the clientele may differ based on the owning business's focus on medicine, which means if you're going to like an oncologist, it may be reserved only for cancer patients or the like. Same with cardiologist, and if you want to go to that office, it's all going to be heart. So the setting that this type of ambulatory care can be seen is vast and is found over many different avenues. Examples of these avenues where ambulatory care is found is in urgent care, freestanding emergency departments, work-based clinics, primary care clinics, specialty care, convenient care, mobile care, and modern technology. Most of us have seen an urgent care, as you can see through the photo. It's usually something that you can go to that's 24/7 or pretty much like that. Emergency departments are in the hospitals, the work-based clinics, and the primary care clinics we'll get to later. Specialty care is more so for what I stated earlier, like if you're going specifically for geriatric care or maybe like heart care, or it's like where the work is specialized towards you. Convenient care and mobile care, and then modern technology are all kind of suited towards you, which a lot of the issues for ambulatory care is trying to get the care to the patient. And with this, the care is pretty much as easy as it can get to you. Now, for the setting types of where certain examples of these different settings can be found are traditional care centers, which are emergency departments. Work-based clinics are often hosted by the large corporations that run them, and the primary care clinics are usually made up of a licensed board of physicians that are private and for-profit. Now, looking at the interdisciplinary teams within ambulatory care clinics, the driving model usually has each clinic focus on its own specific clientele that comes in and mold their care routine around them. Specialty care does this, but at a more specific rate, and a lot of times it requires members of the team to operate at the top of their license while expending minimal cost. What this means is that the team, more so the social worker, but this kind of applies to the entire team as well, is that they have to be able to do more than what their job requirement is. Like you can't just cut it off like and say that is not my job. More so, you're going to want to extend past that to offer as much help as you can, because in medical field, no matter what part it is, it feels like what you do is never enough. So you got to be able to reach everybody, especially on your team. That's why social workers are often found to be the fulcrum or the middleman for all these connections and relationships between the patient and the doctors. Lastly, the specialty care and primary care models are examples of different models with their own focus. Specialty care can focus, like I said, on, let's say, cardiology or oncology or gastrology, all these different types of care where each of them can have their own type of social work to um, meld in within the curriculum of how they want to handle the treatment. And primary care models we stated earlier, examples of. For specialty care models, oftentimes they are program-based and use a team-based approach to connect inpatient and outpatient procedures and incorporates whoever is needed for the job. Primary care models involve pushing the limits of the employees and incorporating them into everyday duties outside of their normal work routine. As you can see from these type of care models, even though they are different, they still ask more than what is required, it seems, which is usually not a bad thing, because not only does it help the company that you're working with and the clientele that you're trying to benefit, but it also benefits yourself because you're constantly pushing past your own barrier that you've had before, and you're always evolving as a social worker and always striving for more information. Now, the action steps for the social workers are what they do normally within the job setting of ambulatory care. This can involve post-diagnosis work with the patient, obtaining whatever they need, and relaying that information to the doctor or the care staff, because they're often the connection between the team and the origin of info. Now, working with so many different clients, you're often obviously going to have to set certain boundaries to maintain a professional distance. Uh, that is only to increase your ability and your flexibility within your job so you can be a help to many more at the same time as helping the person in front of you. Being able to connect with the patient is also an important skill, as stated before, and advocating and empowering the client and using your resources are all that make social workers who they are, especially in the health setting. Now, the policy connection for ambulatory care is often used within this setting as a screening criteria for patients and this services. Now, this policy can incorporate an assessment like a biopsychosocial assessment, which provides a background on the patient and an understanding of what the team is working with. The signs a social worker should identify as need for treatment within ambulatory care centers based on this policy and the criteria screening are abuse or neglect, nutritional or metabolic needs, skin breakdown, fall risk, discharge needs prior to departure, behavioral health risk, and substance abuse. All of these are specialized towards the care of whatever they need within the setting that the patient requires. Now, lastly, the anticipated outcomes are managing the chronically ill patients and social service needs of the patients, and provide care management across all critical avenues. That is what the social worker does within the ambulatory care clinic.